Hi viewers, today our topic is bronchial asthma. Definition of bronchial asthma is, it is a common respiratory illness. The word asthma has long history derived from the Sanskrit word vayu. Its meaning is wind. It is characterized by chronic inflammation of the bronchus. It leads to bronchoconstriction. Constriction means there is a narrowing of the bronchus. Narrowing of the way, it leads to decreasing the airway passage inside the lungs. That is called asthma. Incidence is, it is one of the most common chronic disorder. It affects 11.8% of the children between the 3 and 17 years of age. It is caused by multiple factors. We can't say only one reason, but there is a more reasons will be the multiple reasons is there. It is triggered by varieties of stimuli. Examples as maybe due to cold situations, environment and air, any dust, any smoke, any fumes, any viral exposing, any stress, types of some medications, some allergens if the person is using. These are the irritants triggering the our immune system, and any allergic asthma also will be there, like house dusting, pollen, also smoking. Smoke also one of the reason. Any type of powders, perfumes. These all are the main factors to leads bronchial asthma based on the situation. And coming to risk factors of the asthma is mainly endogenous family history, also one of the reason. Upper respiratory tract infections repeatedly attacking, and any allergic history, and sex also, maybe mostly male persons they will get this bronchial asthma. And exogenous factors like anxiety, emotional stress, anger, frustration, fearful situations, habit of tobacco and smoking, lack of breastfeeding, and environment factors easily exposing to the allergens. Types of asthma is mainly, it is two types: extrinsic asthma or allergic bronchial asthma, intrinsic asthma or non-allergic asthma. Extrinsic asthma or allergic bronchial asthma, it is caused by specific allergens. It is preventable, and the allergens can be avoided to decrease the asthmatic attacks. Intrinsic asthma or non-allergic asthma, it is not caused by the allergies. It is caused by the unidentified factors in the environment. Family history also, upper respiratory tract repeatedly attacking, unknown reasons. Coming to pathophysiology, due to causes, bronchial inflammation will come, leads to edema and bronchoconstriction, increasing the mucus production in the lungs, airway obstruction, and symptoms. Clinical manifestations: sudden onset, non-productive cough, sometimes dry cough, later becomes productive, mucus also will production, nasal flaring or stridor also will be there, tachypnea, chest tightness, severe dyspnea, cyanosis, pallor, sweating, restlessness, night cough, wheezing, tachypnea, nasal congestion. Coming to diagnostic evaluations: history collection, physical examination. Physical examination, you can see four methods already you know: inspection, palpation, auscultation. Mainly you can see here auscultation, percussion. Assess the means you can listen the wheezing sounds. Assess the skin color, cyanosis present or not, and pulmonary function test you can do. Complete blood test also. Chest X-ray is very important, and any allergic test also you can do. Management: immediately you have to go for resuscitation, rescue medications, that is beta agonists, albuterol, and inhalers also you have to use. Corticosteroids also you have to provide, prednisolone examples, and anticholinergics agents also you have to use. Supportive therapy: immediately you have to administer the oxygen. Inhalation therapy also important. Psychological support to the patient and the family members, and fluid administration also one of the important factor. Coming to nursing management, also you can see here history of the child. You have to take examination of the specific symptoms of the asthma, assess the respiratory status of the person, assess the child's anxiety, auscultation, the wheezing sounds. Nursing diagnosis also you know how to write: ineffective airway clearance related to bronchospasm and mucosal edema, fluid volume deficit related to increased respiratory rate and decreased oral intake, fatigue related to hypoxia and increased work of breathing, and anxiety related to hospitalization and respiratory distress. This nursing diagnosis you can form and write. Thank you for this.